So today we're going to be performing a musculoskeletal assessment. So the first thing you're going to want to do is for all joints, you're going to want to inspect muscle size, shape, swelling, color, deformity, and if there's any pain with range of motion. You're then going to want to palpate for any crepitus during range of motion. If there's heat at the joint and their strength level. When you're grading strength, it's from a 0 to 5. So 0 means that they're unable to do the activity at all, and 5 means that they can overcome the strongest resistance. For upper extremities, you're going to perform tasks against resistance. So go ahead and put your arms out. And could you push against my hands? Could you pull back against my hands? And then you are going to want to have them bring your arms up to the side, out, and then lower. Okay? And then you're also going to want for them to grip your hands. So can you squeeze both my fingers? Okay? And the grip is equal on both sides. For lower extremities, you're going to want to raise, lower, push feet, and then pull feet. But I'll do that once I am assessing the lower body. So for your spine, you're going to inspect and palpate. You're going to look for making sure their spinous process is in place. You shouldn't feel any curves or abnormalities. You're looking for lordosis, kyphosis, or scoliosis. And then you're going to want to test the range of motion. So you're going to start with cervical, and you're going to have them chin up, chin to chest, shrug to one side, to the other side. For thoracic, you're going to have them, can you just twist to both sides? And then for lumbar, can you just lean back for me a little bit? Perfect. And all range of motion should be coordinated and smooth. For upper extremities, for shoulders, you're going to want to do internal, external, abduction and adduction, forward and backward, and shrug. So you're going to do internal rotation, external rotation. Go ahead and shrug for me. I'm going to go out, in, flexion, and then extension. Yep. For elbows, for range of motion, extension, flexion, abduction, adduction. Okay. For your wrists, you're going to want to do, go ahead and put your arms out, flexion, extension, ulnar deviation, radial deviation, and then can you just rotate them back and forth? Okay. And then can you put your arms back out? Can you push down against my hands and push up against my hands? Okay. And then for fingers and wrists, you're also going to assess for range of motion. So flexion, extension, fingers together, make a 4, make a fist. Yeah. And then lower extremities. So go ahead and lay down. So she's in extension right now. For flexion, go ahead and bring your knee up to your chest. Go ahead and bring your knee across your body, and then on the outside. Okay, put it down. Repeat with the other leg, please. Up, in, and then out. Perfect. And then can you move this leg out and then back in? And then this leg out and back in for abduction and adduction. For your knees, go ahead and sit up. And if you could stand up for me, if you could just do flexion, extension. Perfect. Both sides, please. Flexion, extension. And then your feet and toes. So go ahead and sit back down. You could spread your toes for me and then put them together. Okay. And going back, inspecting every joint, palpating. So I'm just going to palpate, make sure everything feels normal. With range of motion, there's no crepitus, there's no heat,